Hey there, this is Dr. Daniel Farkas. I'm a certified functional medicine practitioner. And with me, I have the number one coach in the whole world, Brittany Helleberg. Hi, Brittany.
Hi, how's it going? Good morning.
It's going excellent. I'm so glad that you took some time to join me because we're going to talk today about a topic that I think affects pretty much everybody at some point in their life, and that is small intestinal bacterial overgrowth, also known as SIBO, SIBO. Um, So I want you to tell me in your words and in your experience, like, how do you characterize SIBO? Like what is SIBO?
Yeah, so SIBO obviously stands for small intestinal bacterial overgrowth, which is exactly what you said. Pretty much it's when your bacteria from the colon finds its way up into the small intestine. Your small intestine is where most of your nutrients are being absorbed, and everything's taking place with the absorption in the small intestine. And it's when your bacteria pretty much make a home in there and gobble up all the nutrients that would normally go directly to your cells. One thing that's very interesting is that 64% of first GI specialists involve SIBO, and 60% of clients or patients who have IBS could be traced back to SIBO, which is really interesting. Like I said, too, SIBO causes malabsorption issues, which can lead to, let's say, brain fog, things like that. So wanted to ask you, what are some of the symptoms that you see with your clients or your patients who present with SIBO symptoms?
That's interesting. There are a lot of possibilities there. If you Google like SIBO symptoms, like you could trace so many health concerns like back to SIBO, or that it's a big component of what's going on. Symptoms that I would see with people that complain of IBS, irritable bowel syndrome, either constipation or diarrhea, bloating, cramping, lots of fatigue too. But you characterize it perfectly because the bacteria creep back up into the small intestine and they overgrow and just cause just crowding and chaos. Because we know that healthy bacteria actually make about 90% of our body's supply of neurotransmitters. Neurotransmitters like dopamine and serotonin that keep us feeling not anxious, not depressed, keep us feeling calm, make us sleep normally, and on and on and on. They control our mood. It's so weird to like know that something that's not human lives inside our intestines and makes stuff that controls our mood. These people invariably have some type of anxiety, some type of depression. They're an antidepressant, sleep pill, adult or child ADD or ADHD, OCD medication too as well. So point is like I see those GI symptoms, that's like clockwork. But a lot of times what goes along with that are the behavioral and mood problems, the anxiety, the depression, and the antidepressant use. And I got to say, 1 out of 5 women is either on one, has been on one, or will be on one, an antidepressant. So those are the symptoms that I see. I see people trying everything and anything to help themselves. Number one thing I would say that people run and go do is they go run for probiotics. Long time ago, I went to EMT school. I was in the military and I went to EMT school. And sometimes we would get called to a restaurant for someone who's choking. You know where you go? The bathroom. They're in the bathroom because that's what you do when you're choking in a restaurant. It's embarrassing. You run to the bathroom. It's like this reflex. I find that when people get GI problems, they run to probiotics and they get the biggest one, the most expensive one that's refrigerated, that has the nicest packaging, that's $70, and they start taking that like crazy. But I there are varying opinions on if that's the right thing to do. Tell me what your impression is of probiotic use when you think or you know that you have SIBO.
Yes, I am so glad you asked me that. And you are absolutely right. I see this all the time with my clients. Before when they start working with me, everyone reaches for probiotics. They go look for, they Google the best one, or let's say they buy the most expensive one. When in reality, probiotics are good, but whenever a client has SIBO, you first have to identify the root issue. You first have to essentially eradicate the bacteria in the small intestine. Because if you're taking probiotics whenever you have SIBO, you're essentially almost feeding the bacteria in the small intestine, which is, that's not the whole purpose of what you're wanting to do. So I think probiotics are good. Absolutely. I think you definitely need to have a balanced gut, essentially, of, good bacteria. But whenever a client has SIBO, that's one thing, that's the first mistake that they make, is that, okay, I'm going to go take some probiotics, and essentially it doesn't really help. So there's a couple things in here that I wanted to go over. The 5 causes of SIBO. So why does someone get that? First one is a deficiency in the migrating motor complex. So your body has 2 modes. You're either digesting or your body is cleaning the food out. Essentially, this happens every 90 to 120 minutes. So anytime that you put food in your mouth, whether that's gum, for example, everyone likes to chew their gum. It's essentially, putting the migrating motor complex stops. So then it's in the mode of eating and digesting. The second one is a defect in the ileocecal valve. The third one, structural defects from surgery or diverticulitis, a weakened immune system. Obviously, if you have a weakened immune system, your body can't fight off any infections, whatever's going on in your gut. And then a compromised digestion due to low stomach acid or and digestive enzymes. If you don't have proper amount of stomach acid, you don't have the digestive enzymes to break down the food, everything essentially is going to ferment in the gut, causing you, the gas, bloating, all of the not fun symptoms that, people want to have. So whenever someone is presenting with your symptoms that you mentioned before, there are 2 types of tests, which many people I'm sure have heard. There's a hydrogen breath test. You can detect hydrogen, which if you're having diarrhea, and then methane if you're having constipation. Now, the thing is with these breath tests, it just tells you if you have SIBO, but what I want you to go over is what are some of the treatments, what treatment plan do you recommend for your patients to identify the root issue?
That's good. The breath test. Perfect question. The breath test is what they would call the gold standard, and they test for those gases. It's kind of a weird test. There's a little diet preparation you do for about a day or 2. Then the day of the test, you breathe in this bag about 3 or 4 times once per hour. And then it goes off to a lab. They check for those gases, and then that determines what type of antibiotic and or natural mixed with a natural approach to wipe those things out. What I find though is before or along with that, I like to do some more specialty testing. And the good news is that there's something that I use called a GI map, and it is the only FDA cleared test that uses DNA technology to test for DNA evidence of good and bad things like pathogens. And it also reveals a huge array of bad bacteria that can overgrow, as well as healthy bacteria levels, as well as it can tell us, are you getting enough digestive enzymes? Are you getting enough bile to break down your food? Certain healthy levels should be left over in your stool. And if they're not there, then you know that contributes to, that's a contributing cause to one of those 5 reasons that you named. And they're allowed to have more than one too. You can have 1, you can have 2, you can have 3, you can have 4 or 5 or all of those issues. Treatment wise, I like natural. And the best news is that the natural approach has been found, and this is from a National Institute of Health study, that the natural approach using a couple natural substances together, sometimes along with one other complementary thing, every person's different. So I'm not going to try to be specific because I don't want to confuse people or make them think, oh, that's exactly what I need, because everybody's different. But those things, when they're used consistently over 60 days, along with some proper management and coaching along the way, has been found to be more effective than any prescription agent. I got to point something out though, because we know that the nervous system runs everything. It makes us digest our food. But we know that when we get stressed out, when we get in a stressed out mode, or we get scared, that for efficiency's sake, the body will turn off normal digestion and stop making those normal digestive enzymes and acids that breaks our food down in a healthy way so it doesn't ferment and grow bacteria unnecessarily. What I see overwhelmingly in my clients is, yes, they have these clinical presentations. Yes, they do a breath test, it's positive. Yes, we do a specialty GI map test. And yes, there's a bunch of positive factors. But I dig a little bit deeper and I ask them, I say, how's your stress? How's your chronic stress? And every single time they go, oh man, they're like, oh, I got stuff going on, especially with the global pandemic that's going on. I've seen it more than ever. So anyone who's listening or watching this, if you feel it, even if you don't feel like you've been touched dramatically by the stress, you're living in a world that's full of it. I have found that if people will do the easy part, which is to get tested properly, follow their natural treatment regimen to a T, but also work with someone who can help them to identify their stresses and cope and manage them better and change the way that they handle stress so that the true reason for their SIBO actually goes away. If they don't do this, if this doesn't get addressed, that's where I feel it becomes recurrent. They're like, oh, I had it last year and then it came back. I was good for 2 years. It came back. I had it and I was good for a month. And then I took another test. It came right. Like, why does this keep happening? I'm like, your digestive system is essentially turned off, though you keep shoving food in there. You need coaching, you need guidance and help. Every great professional athlete, every champion has had great coaches behind them. No one can do that on their own. And I don't think that people are getting the care that they need when they're handed a prescription, an antibiotic, and pushed out the door for their SIBO. My approach is that I recommend that they work with a coach that understands about that. And that's why I got to tell you, of all the coaches, all the professionals I've met, you seem and have proven to have the best grasp on that and what that takes, because I understand your story includes this issue too as well, and you understand it so well, firsthand approach, good or bad. It's like your pain is their gain. I've had issues too that help me understand my clients too, but I just can't stress enough about the exponential improvement clinical outcomes when people are working with a coach.
Exactly. And I'm so glad you pointed that out, because this is why we make a great team together, where you can identify, we can figure out the root issues. And then from the coaching standpoint, I'm supporting the clients every step of the way, holding their hand, really just like balancing their life again and allowing them to regain their life. I actually had a call with one of my clients last week that you spoke to as well. And she was practically in tears because, she said, finally, she went to the hospital, she did everything. Finally, someone gave me an answer. After 4 years of jumping from doctor to doctor, finally, someone could tell me exactly what was going on. She was in the hospital not too long ago, and, no one could figure out exactly what was going on. So from there, we did the GI map test. We got her results. We started her with the coaching program, and I feel like she's just doing amazing. And all the clients that I work with as well, it's always a GI map test. Let's figure out the root issues and let's solve the problem to where you can regain your life. So I'm really glad that you pointed that out.
Yeah, it's great that anyone who watches this or sees this, if you want, you can have access to both of us. I like a team effort. Two heads are better than one. I do the easy part. You hear me say that a million times. I'm like, I do the easy part. I order some tests. I've done this for years. I know what people need clinically, but to change the course of how people's, stress gets handled, their methods, and to just, like, I won't say hold someone's hand, but just to guide them along the way, just like climbing a mountain in a snowstorm. It's like you need a guide or you're not going to get there. If you do, you're lucky and you're probably going to suffer along the way. It gets them to where they need to go faster. It's an investment in time and effort. It just, the results are just exponentially better. And I'm about this far away from being with my SIBO clients. It's like, look, if you want to work with me, you got to have some type of coach. You got to have something in place, or we're going to be at this forever. I don't want all that burden on me that I have to solve. I can't solve those problems. But by taking a multidisciplinary approach, like success is virtually guaranteed.
Absolutely. Well, I'm so glad that we talked today about SIBO. For anyone who's